Mid-back aching and pain is a common and overlooked problem that I see in my practice on a regular basis. The problem with this issue is that it's not often fully addressed, and it is not easily remediable by very basic therapies that people tend to go to, including massage, acupuncture, chiropractic, and basic physical therapy. The number one reason, of course, is underlying pathology needs to be ruled out. Of course, going to your doctor, making sure that there's nothing going on with the internal organs, there's not an underlying pathology of the spine, and so forth. A lot of people do not have that, but deal with constant nagging mid-back muscle-based pain. So overcoming this issue, I've found, is not as simple as doing one stretch or one exercise. I use a four-pronged approach, which I'm going to outline in this video. Number one, we're going to do a simple self-evaluation to test the rotation capacity of the mid-back, which is oftentimes quite limited. That leads us into step number two, which is a series of self-mobilizations that you can do to improve thoracic spine mobility. Then the next piece that we're going to discuss is how to identify muscles that are tight that can affect this area and how to specifically stretch them. Now, last but not least, we're going to look at the muscles that we need to improve both strength and endurance in. And of course, I'm going to give you specific exercises to address those. So be sure to stay tuned for this. Each step in the series, you're going to want to bookmark this video. You can jump ahead to any parts that are most relevant to you, but I urge you to watch the video straight through so you can get all the steps necessary to address this mid-back aching issue. So let's get started. Okay, so let's start with a quick self-assessment. I find the absolute best way to accomplish this is with a Sidelying rotation-based test. So there are a lot of movements in the spine. They are coupled motions. We have flexion and extension, we have side bending, and we have rotation. Now, when it comes to these movements, when I say that they're coupled, side bending in the spine, in the thoracic spine, is coupled with rotation. So when we test a rotation-based movement, we're also testing side bending. So this is the primary function of the thoracic spine, although we mostly oftentimes associate that with how well we are extending our spine or getting upright in terms of posture. So this is a really, really good self-evaluation test that we will also turn into a self-mobilization. So let me show you how it works. We're going to lay in a side-lying position, and we want the head and neck propped up to be roughly in line with the rest of the spine. We don't want the head dropping excessively down to the table or excessively up to the sky. So we're going to lay on our side, and we're going to position our hips and knees roughly at a 90-degree angle. Predominantly, we're placing the hips at a 90-degree angle to put a slight degree of neutrality, if not slight flexion, in the lumbar spine, to discourage it from moving so much so we can get a better evaluation on the movement of the thoracic spine. So the arm is placed out in front. You can see my head and neck is roughly in alignment with the properly placed pillow. We're going to place our top hand, in this case it's my right hand, on top of my forehead. I'm going to keep my knees together, so when we start to turn, we do not want to see the knee popping up or the hip starting to shift back. So if you want to, you can place this top hand on top of the knee just to make sure that we can monitor if it's moving or not. All we're going to do here, we're not going to pull on the neck, is to gently rotate and just see how far we're able to comfortably go into rotation without that knee sliding back. Okay, so this is about as far as I can comfortably go here in a cold state. I'm not warmed up. So that's a good evaluation right off the bat of how much rotation I have available. Now, as we do repetitions on this, the range of motion is going to increase as it does with virtually any movement. If you do it cold, it's going to be a little stiffer. You're not going to have as much freedom of movement, but as you warm up, it will get better. So this in a cold state is our evaluation of just basically how far we can go. Now, what we would want to do is we want to test the opposite side as well and get an assessment of how far we can go. Do you have more range of motion going to the right, or do you have more range of motion going to the left? And we can use that for additional evaluations later when we're talking about left and right side asymmetry. So if you feel lower back discomfort during this movement, oftentimes that's associated with, number one, rigidity or stiffness in the thoracic spine. So as you're starting to rotate, you're feeling more pressure down in the lower lumbar spine. A quick test that you can use for this is to just bring the knees up even higher with the intention of flattening or
flexing the lower lumbar spine to hold those segments still, and you can rotate. And oftentimes when you do this, you'll feel that your rotation is even more limited. And again, that's because we're not allowing that lower lumbar region to move, which would give us more range of motion. Okay, so this does come up quite frequently in individuals saying, this feels uncomfortable in my very lower lumbar spine. If that is the case, then again, we have those knees flexed up a little bit higher. So we want to see how far we can go. Ideally, not in 100% of cases, but ideally we would like to see the arm move relatively close to the ground. So if it's hanging up about 12 inches off of the ground, we know that there is some strong restriction in your thoracic rotation. Not everybody is able to get all the way down to the ground, but let's say on average we want it to be anywhere from 4 inches at least, if not lower, to the ground. But for each individual, the point is not that it has that full range of motion down to the ground, but you're making progress on it over time, and we're improving mobility in the thoracic spine. Okay, so now that we have performed a thoracic rotation test, we can use that exact same position to perform mobilization of the thoracic spine. And how we would do that is to perform repeated rotations with the addition of a breathing component. Now, important to understand that the thoracic spine will rotate itself, but what do we have that connects to the thoracic spine? We have ribs. And when we have ribs, we have breathing. So breathing is a very important role in thoracic mobility, so we need to capitalize on it while we do our mobilization. So we're going to lay back in that side-lying position with the hips and knees at 90 degrees. We can either anchor the knees down with our bottom hand if we want to, but we do not have to. Top hand goes on the forehead. Now what we're going to do is we're going to bring this top elbow all the way down. That's going to encourage a rounding or flexion of the thoracic spine. As we turn, we're going to breathe in nice and deep, and the emphasis is going to be on the top side ribs. So I'm going to breathe in nice and deep with the intention of expanding my right ribs. And then when it feels good to do so, right as I kind of round the corner where gravity starts to allow me to drop down, I'm going to find the optimal time to exhale and relax. Just letting that air go. You don't want to pull using your muscles into the rotation. You just want to let gravity do the work. So we exhale, we relax into it just for a moment or two. And then when we rotate out of it, it does not matter how you breathe. So because it does tend to create a little bit of breathing anxiety to try to figure out which way we should be breathing, the only thing that really counts is nice big deep breath as you turn and then exhaling and relaxing toward that stretch position. And then we don't care wherever we are in the breath cycle, just return all the way back to the start, bringing the elbow down. So again, nice big deep breath. At the right time, exhale, relax. Hold for a moment or two, and then return back to the start. We would repeat this movement over and over again, on average at least 10 repetitions. Sometimes we can go up to 15 or 20. My rule of thumb is as long as there's no discomfort, we would continue doing repetitions until there's no longer an improvement in range of motion. Once the range of motion has stopped improving, we're done with that side, and then we would go ahead and switch to the opposite side. Most of the time you'll start seeing improvement in range of motion within a few repetitions, at least less threat, less guarding, and less restriction. Just allowing yourself to relax into that position is going to assist with opening up mobility in the thoracic spine and of course the ribs as well. So again, this would be performed on each side, and you would note the amount of gain or progress that you make on both. Which side do you make more range of motion progress on is notable.
One of the most helpful and common mobility drills for the thoracic spine is foam rolling. We can use the foam roller to lay back over and improve thoracic extension in particular, so it's very, very helpful. Now, probably the most important note on this is that when we do foam rolling, it should be comfortable, shouldn't be excessively painful. And of course, the areas that we do not roll on, we do not need to roll on the cervical spine, and we do not need to roll on the very lower back, the lumbar region. We want to stay right into that thoracic zone. So when we lay on the roller, we want to start in the area
where we're essentially just below the shoulder blades. So from this position, I'm going to roll down. Right below the shoulder blades is a comfortable place to start. Now we want to keep the hips on the ground, okay? We don't need to lift them up. That is actually a more advanced technique once you learn how to control your pelvic tilt and where the pressure is on the spine, so I don't advocate for starting with that. You're going to take your hands and you're going to interlace them, and you can place them either behind the head or behind the neck. We just want to encourage not yanking on the head and neck. You're going to want to bring your elbows in. That moves the shoulder blades out of the way, so you're actually resting the roller on the spine and not on the shoulder blades. And from this position here, if you have a tendency to have a lot of lower lumbar spine movement, usually in this position here we're in a little bit of flexion, but if you need to, you can do a little bit of a tail tuck just to discourage movement in the lower lumbar spine and isolate the higher segments up. Now from here, all we're going to do is to slowly just dip our weight back, just using gravity to assist. And right there is a light amount of discomfort. I'll hold that for 1 to 2 seconds. And then essentially what I'm going to do is perform like a crunch coming up off of that segment again. So we will repeat this process, just lowering all the way down to comfort and back up again. Now, oftentimes there is a breath that's associated to this, but it can be done either way. You can inhale when you go back, or you can exhale when you go back. Both of them will have a distinct benefit, and that is based upon your perception of what makes it feel better and is getting the job done, okay? So in this case, I am going to exhale because it helps me relax my muscles, so I will exhale, hold it for a second, and then come back up again. After I've performed a number of repetitions, probably somewhere around 5 to 10, once I feel like I'm not making any more progress, then what I'm going to do is I'm just going to slide down just a little bit more to the next segment. And I will repeat that procedure, just allowing myself to dip back, holding, and then coming back up again. Now, as we move up the spine, I'm probably only going to get about 1 to 2 more levels up before I start to lose leverage, and it feels like the roll is going to flip out that way. Once we get to that point, we're going to reverse direction, and as we started below the shoulder blades, now we're going to go a little bit lower. The reason why I don't start from this area is usually because it's quite immobile and it's tender, so it's easier to get the higher segments going first and get yourself comfortable with the extension before you attempt to go lower. But you can certainly start here, but the warning is it's going to be quite sensitive. So once I get to this point here, just laying on this area is a little bit tender. I'm not going to be able to comfortably go back too far. I'll feel my abdominal muscles quivering and I feel apprehension. When I get to this level, we do just little mini repetitions. So it's very little. Take that exhale, go down, hold it for a second, and then go back up again. The range of motion is very, very small. Once we get to that point, even just rolling on this section where I'm about the thoracic spine meeting the lumbar spine, it's tender just laying on it here in flexion. Again, I can do little kind of mini repetitions, okay? Still repeating the process, can go anywhere from 5 to 10 reps. When we're finished, we just roll off to the side of the roll, and that completes this mobility drill. Now, another effective stretch that we would use to improve thoracic mobility is the side bend stretch. Now, side bend stretching can be accomplished just reaching over, grabbing a door handle. These sorts of things are classic stretches, but whenever possible, I would prefer to use a Swiss ball. A Swiss ball allows you to comfortably lay over the top, to target that area, to rest into that position without a lot of muscle activity and get a better stretch, okay? So we would use the appropriately sized Swiss ball. For most people, a 65 centimeter ball will work best. Some people, a 55 centimeter, although I get asked this a lot, as long as the ball is not too big, like a 75 centimeter, it'll work for most people with just a regular old 65, okay? Now I'm gonna do this in the middle of the floor, but I do oftentimes advise people to do it with their feet against the wall just to improve the balance component, okay? We want to set the ball on the floor. You can see the apex of the ball here is on that little stopper right there. So I'm going to sit off to the side or take a kneeling position and then sit my hip on the side of the ball. Now I should be able to lean against this comfortably if I'm in the right spot. That way for balance component as I lay over it, I'll be in the right spot and I won't fall off the ball. So I'm going to put my hand on the floor and then I'm going to start scooting down. The top leg goes in line with the body. This is the one that's most important. The bottom leg just stays out in front and it's there for balance. What we're going to do is take this top arm and just reach right over the top. As I do so, you can see that my torso is bending over the ball. I'm now starting to get a stretch right into this area. I'm getting the lat muscle, I'm getting the quadratus lumborum, I'm getting the obliques, and of course, a little bit of the glutes here as well. So as I reach and I comfortably rest into that position, I can start to modify depending upon what I feel. So if I want to emphasize more of the lat muscle and into the lower back, I'm going to keep my pelvis here and I'm just going to rotate my upper body forward just a little bit. As I do so, I feel that stretch going right down there across through the mid to lower thoracic spine into the low back. Now, because in this position we're stretching into a side bend position, breathing becomes really key. As I take a deep breath, I am limited on how much airflow I can get into my left. I'm going to feel my right side expanding, which is exactly what I want. So as I stay here, nice big deep breath. I feel my right side expanding. As I exhale, I relax. I try to sink into the stretch a little bit more. So I'll repeat this oftentimes, doing side bend stretching up to 60 seconds. And then of course, we will do the other side. Now after doing this, we can recheck rotation, the Sidelying rotation assessment. Oftentimes there'll be more range of motion, and that's considered a successful contributing stretch. Now, although it's less commonly discussed, one of the muscles that can limit thoracic rotation is actually the psoas muscle. The psoas is a hip flexor muscle. It connects to all 5 lumbar vertebrae and the inside of the hip. So oftentimes in the office, if a client has limited thoracic rotation, one of the tests that we will look at is the psoas, and if it is found to be positive and it's tight, we will stretch it and then we will recheck the thoracic rotation to see if there is improvements, and oftentimes there is in some cases. So this kneeling hip flexor stretch with an emphasis on the psoas is key for improving and maximizing thoracic mobility, in particular when there is stiffness, tightness, and pain in the mid to lower thoracic spine. So we're going to take a kneeling position with one knee directly underneath the hip and the other foot out in front for balance. Now, what we want to do in this position is to flatten out the lumbar spine. So what that means is we are going to perform a fairly aggressive tail tuck. So once I do that, on a tail tuck, I'm going to feel a stretch in the quadricep muscle. This muscle is the rectus femoris. That's not the one that we want to target. We want to target the psoas. So once we do that tail tuck, here's what we're going to do. Move that front foot out in front of you. And what we're going to do is, while maintaining that tail tuck, start to bring the pelvis forward while maintaining the tail tuck. That is going to reduce the emphasis on the quadricep muscle and increase the emphasis on the deeper psoas muscle. You can see here that I rest my elbows kind of unconsciously here on my front leg. That helps with balance and helps me focus on the deeper stretch. So again, this is critical. If we perform this exercise or this stretch in the upright position, it's more quadricep focused. Nothing wrong with that, but we're trying to get to the thoracic spine via the psoas. So we want to maintain that tail tuck and shift forward, forward, forward. Okay? As I go forward, I don't want to arch my back because I've lost it. I tuck and I shift forward until I feel a shift in the type of stretch that I feel in the hip. We'll shift and we'll hold that position for approximately 30 seconds, back off, and then we would do the opposite side. We would go back and forth for 2 to 3 repetitions, holding for 30 seconds. So that is the kneeling psoas stretch. Now, another effective stretch that we're going to use is stretching the back muscles themselves. Now, this seems counterintuitive since a lot of people feel like they slouch, that those muscles would actually be in a lengthened position. While that might be true sometimes, we have to consider that certain sections of the spine are tight relative to others. So there are a lot of people with a flattened upper portion of their thoracic spine, and they have a lot of rounding in the lower, as you'll see with me. So this means that there needs to be an emphasis on those reduced curvatures in the thoracic spine. So we're going to do this in a quadruped position. It's very similar to what we would call like a cat-cow based stretch. Very easy to do, few key pieces to this. So we're going to go on the hands and knees. Now, because we're trying to target the thoracic spine, we want to limit the amount of lumbar position contribution. So we're going to perform a little bit of a tail tuck here. That's going to flatten the lumbar spine. Now, to emphasize the thoracic curvature, we're going to do two things. Number one, we're going to push the floor away from you. So when we push the floor away, that helps us round or target the upper thoracic spine via the serratus anterior muscles. So I'm going to push, and then second of all, what I'm going to do is imagine that I have a hook in my mid-thoracic spine, and I'm going to lift that up to the sky. So we're pushing, we're lifting that thoracic spine up to the sky, and then adding a little bit of a tail tuck. Now at this point, you may or may not already feel a stretch. The next piece will really get the job done. So as we maintain that positioning, we're going to draw a nice big deep breath. Now, if we're positioned properly, the breathing should help feel it in the expansion in the thoracic region, because we're not able to breathe elsewhere, because when we're pushed and we're rounded, our abdominals are holding the ribs down in the front. So as we hold that position and we breathe in, we will feel the stretch across the mid-thoracic spine. We would take about 5 to 10 nice big deep breaths and then relax everything, and that would accomplish the stretching for the mid to lower thoracic extensor muscles. Okay, one of my favorite exercises to use for increasing static endurance, that is a holding position for the thoracic extensors, is called the prone extension exercise. Essentially, this exercise is laying face down and lifting the sternum up off of the ground with the intention of reversing thoracic kyphosis. So the curve is flexed. Our goal is to extend up from this mid-thoracic region. So it's important that you achieve adequate mobility in the thoracic spine prior to doing this exercise, or otherwise people will oftentimes tell me, I feel this like in my lower back is fatiguing. Well, that's because if there's not enough extension available in the thoracic spine, we'll oftentimes start trying to extend from the lumbar spine when doing the activity, and thus we'll be feeling fatigue in the lumbar extensors. This is not necessarily a bad thing, but it is not targeting the one area we are trying to target, which is the mid to lower thoracic spine. So it's important to note before you do the exercise. The next thing is that when you do the exercise, the goal here is to hold with a moderate degree of intensity. We are not trying to max out the squeeze on the muscle and try to contract it as hard as we can. Obviously, if you do this, it's going to reduce the available endurance when doing the exercise. Plus, we're not trying to teach to hold a max contraction when we're trying to use these muscles, because we are trying to improve its endurance at moderate to low intensities. So very, very important to note before we do the drill. So the optimal prescription for exercise time here is to start with holdings for something simple like 10 seconds, and then resting for about 5 to 10 seconds and repeating about 10 more times, and gradually increasing the holding time over time. So with most of my clients, I am aiming for being able to hold this position for 1 repetition of 3 minutes. Now, obviously that's a good challenge. It will take most people a good amount of time to reach 3 minutes, but it varies. It could be 3 weeks, it could be 8 weeks to get to that time. But once we reach the 3-minute mark, we essentially are going into maintenance for this drill. So let me show you how this is done. You're going to lay on a comfortable surface. I recommend doing it on an exercise mat on the floor. And I'll try not to disturb my microphone here. But what we're going to do is we're going to lay face down, okay, with our legs straight. We're going to start with our feet together. We're going to squeeze our butt muscles. That is going to tilt or tuck the lower lumbar spine and reduce its contribution. What we're going to do is to just gently push the sternum into the ground, thus lifting our chest up off of the ground. Going to feel that immediately in that mid-thoracic spine. And then we're going to tuck our chin down to the ground to keep our head and neck in alignment with the body. Now the final piece on this, if you're on the ground here, is to lift your hands up and bring your shoulder blades back and slightly down away from the ears. Now you can see we're holding this position. Commonly you'll see online is lifting the legs up off of the ground, but we do not want to do that. That's going to further enforce working the lower lumbar spine, which we don't want. So we're going to hold this exercise for the noted amount of time, in this case 10 seconds, and then we rest back down again, and we would repeat that 10 times. Okay, so one of my go-to exercises for improving strength in the thoracic region and the rib cage is a rotational based exercise. We can use a one-arm dumbbell row for this purpose. So if you remember when we were doing the mobilization phase, we were doing side-lying rotation mobilizations. So that would be to improve thoracic mobility. Now we're going to use that same kind of rotary pattern to strengthen the muscles that surround that area as well. So usually we can use a bench. If you don't have a bench available, then of course an ottoman or something similar can get the job done. We'll need a dumbbell as well. So we're going to position ourselves so that we have one knee on top of the bench. In this case, it's my left one. Now that same side hand is going to be positioned on top of the bench as well. So it's left knee, left hand, and we have our dumbbell down on the floor. So this leg just needs to essentially be out of the way. So you don't want it to be all the way up here, because then when you row with the dumbbell, the leg is going to be in the way. So we want to bring that back quite a ways. Now the lower back is not really at a risk point in this position. We just want it to be in a quasi-neutral tilt. We don't want to have an excessive arch. We don't want to be fully flexed. Neutral will get the job done. We reach down and grab that dumbbell. Now the trick on this is to make sure that we get a full range of motion. So we allow it to go all the way down, and I will allow myself to reach down to the ground to improve the rotation in the spine. And then on the way up, the emphasis is initiating with the spinal rotation, and we follow through with the arm. So I start to turn, and then I pull the dumbbell up. Once I get up here to the side, I can add a little bit of extra rotation just at the top, just to make sure that we're not staying in a neutral position and just rowing with the arm. Because the outcome here is to improve rotation, and that's the primary outcome here, means that we have to just move everything rather than just the arm. So we pull and we twist, and then we go all the way down. Full range of motion, nice and smooth activity. You can inhale or exhale at whatever feels appropriate. It's a little challenging to inhale as you pull. Feels kind of weird, so you can exhale on the way up and then inhale on the way down, whatever works for you, as long as we're getting that full range of motion. Okay? So usually in this exercise, we would use a higher number of repetitions, anywhere from 12 up to 20 on each side, making sure that we're going all the way down. And when we get to the top, just adding a little bit of a twist at the top. If it's uncomfortable for some reason, or you feel like something's going to cramp, sometimes that does happen when you try to turn too much at the top, then you can limit the range of motion just a little bit on the twist. But the single arm dumbbell row, very, very helpful for strengthening all of the muscles around the mid-thoracic spine. Okay, so the last strengthening exercise that I recommend is going to be a crunch with a bit of rotation. We call it a dumbbell serratus crunch. That's usually done with two dumbbells kind of crunching up to the sky, but we're going to use one in this case because it's going to allow us to rotate. Here's how it's performed. So we're going to lay on our back with our feet flat down on the ground. And just walking through this from a technique perspective, we've all probably been familiarized with a crunch activity. If my arms are up to the sky and then I crunch up, I'm going to be using my abdominals. My thoracic spine is going into flexion. If I were to perform this with one arm, so if I have my right arm up to the sky and I reach with my right arm, I'm going into flexion, but I'm also rotating to the left. So I will feel my left spine flatter against the ground relative to my right. Now this extra reaching motion, by reaching up to the sky, the reach is performed by a muscle called the serratus anterior. The serratus anterior is pulling on our ribs, okay? So that's why it's called a serratus crunch, where we're actually reaching with the arms. Now the serratus is a very strong muscle, so just reaching with just your arm, not really that hard to do. We can add a little bit of extra weight. Now again, always starting off with light weights. This is just a 12.5 because I have it handy. So I would reach up to the sky, and all I'm going to do is just try to reach to the sky. That's going to initiate the abdominal muscle activity. So I reach and I hold it, bring my chin to my chest, and I just follow through with it. So I'm reaching up to the sky. I feel a stretch on this side of my rib cage. Of course, that's my lat. And then I just unroll it down to the ground again. So I reach, feeling that spine rotating to the left, and then going all the way down again. So we'd repeat that for relatively higher numbers of repetitions. The limiting factor here, of course, is the fatigue on the neck. You can always use one hand behind the head as you do the exercise just to carry some of the weight of the head. But we would aim for roughly 12 to 20 repetitions on this side, and then we would probably take a break just for the neck, and then do another 12 to 20 repetitions with the opposite arm. This would normally be done for 1 to 2 sets, again, based upon endurance of the neck. So this is the supine single arm serratus crunch.
Okay, so that sums up our video. There were a lot of steps in this video. I know it was a long one, but if you want to be thorough with the work, we need to cover all 4 steps: assessment, mobility, stretching, and of course, increasing strength and endurance. This is by no means a complete list of all of the things that I would necessarily do for this problem, but of course, it depends on the complexity of it. Now, if you'd like to see more, and in addition, the additional exercises, stretches, and so forth, be sure to like this video and comment down below. Let me know what your thoughts are, and if you're interested in another video on the topic, and it'll go on my filming list. Thank you so much for watching, and I'll see you next time.